Hey everybody, it's 6 p.m. on September 24th, 2017. This is Dr. Z with Rebound Your Health TV, also known as Dr. Z. I am here live and we're going to discuss today cupping. It won't be a long broadcast, but we're going to get right into it as soon as a few more people come into the room. So if you get in here, say hello. This information, again, as usual, is here to be an educational tool. It's not meant to necessarily diagnose your particular issue, but just let you know what is out there, what's out there, what's present for people that have pain, that want to prevent pain, prevent injury, improve their performance in terms of our competitors, our MVPs out there, be it you elite athlete, amateur athlete, whatnot. This information is for you, even if you're not an athlete whatsoever. Okay, so come on into the room. Welcome to the broadcast. Let yourself be known. Let me know that you're here. I'll say hi back, and we can get very engaged with each other today. I want to make sure that y'all get this information. Again, sometimes information is specifically speaks to you, and sometimes information may speak to somebody you know. So that's why I say sharing is caring. So if you get in, go ahead and click share down at the bottom of the screen. I think you have to scroll up or to the right. Can't remember which one. But one of those scrolling swipies will allow you to get notifications as well as sharing this broadcast so that yourself and others can actually be able to benefit. Hi, Dr. Ashara. Thanks for coming. Welcome to the broadcast. And we're still there. Okay, just double checking. Hi, Dr. Ashara. Welcome to the broadcast. Sharing is caring. Go ahead and share. Thank you for joining us today. That's cupping. What is it? Who is it for? Is it safe? I have all these questions asked of me somewhat kind of late, recently of late. I'm not exactly sure which was prompted this conversation today. But also just over the years, as I've been trained in, cupping and some other areas of what you call, quote unquote, alternative integrative management. So this is one of those things that I get a lot of questions about. Hi, Dr. Creed. Thanks for joining us. Welcome to the broadcast. Sharing is caring, so click share. Again, this information may be helpful to you or someone you may know. Some people don't know about it. Some people have heard about it and just have to is it even safe, right? You know, you see all kind of things in the media, especially as you continue to see pop culture embracing it. You're kind of like, well, what is that about? When Paltrow has been on the red carpet with these big bruises on her back. Michael Phelps, Olympian, elite world athlete. He's had those as well as a lot of his teammates. So we see it a lot in the media. I'm not sure what it is. Is it safe for everybody? Those are the kind of questions I'm going to answer for you guys today, okay? So welcome to the broadcast. Click share. I'll kind of give maybe 60 seconds, okay, before we jump right into it. I won't make this a long broadcast because today is, I don't know, just one of those days, right? But I still wanted to come in and give you guys the information so that you are totally aware of what to expect and what kind of questions you need to be asking your physician, your doctor, should you be considering a particular doctor that says they can do cupping, so that you can make sure that you're in safe hands, okay? So that's the main point of this. So click share. Please invite your friends to listen into this broadcast. Even if you invite them, they'll be notified that if they can't watch it right away, they can be able to watch the replay if they have a notification or invitation to view this broadcast. Okay, so I'll get into it. I see a lot of people here coming in. Welcome to the broadcast, everybody. Say hello to everybody that's here. You're entering the room, so to speak, or at least the broadcast here with me, Dr. Zarina, also known as Dr. Z. This is Rebound Your Health TV with Dr. Z, and we're going to discuss the cupping. What is it? Who is it for? Is it even safe? So y'all know me. I'm Dr. Zarina, and also known as Dr. Z, here to help you rebound your health through my different programs, concierge practice, private practice, other programs, consulting services, telemedicine, and other programs and products to help you ultimately obtain pain freedom. You're your MVP, and you're going to rebound your health. That's what I'm going to do through all the different services I try to provide to you guys. And one of those ways is through this broadcast, Rebound Your Health TV, okay? So that's me. Let's get right into it. What is cupping? I'm curious because I like to be very interactive with you guys. If you have a question or you have an idea what you think cupping is, go ahead. Go down into the comment section. Hey, Dr. Dre, thank you for joining us. Hey, Dr. Sam, thank you for joining us. Welcome to the broadcast. This is Rebound Your Health TV with Dr. Z, and we're going to discuss cupping. If anybody thinks they may know what it is, go ahead and jot maybe 2-3 words down there what your understanding is of cupping. I like to be interactive because I kind of like to know, what do you think it is? And then I can help debunk some of those myths possibly, or confirm that you actually are right on the target. Hi, Zakia. Hi, Catrice. Thank you for coming to the broadcast. Share, 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 click share. Sharing is caring. This information may be helpful to you or somebody you know that may have pain, that don't have pain, but they want to prevent pain or some injury, or they want to improve their performance, their competitors, be it elite or amateur or otherwise. And you don't even have to be an athlete to benefit from this, right? From this information, I should say. So first of all, cupping in general is been around for thousands of years. When I say thousands, over 2,000 years. And essentially, where early presence of it, I would say, is people think of Chinese medicine, right? However, not only was it present back over 2,000 years ago, and many millions of people have benefited from this practice, but also in the Middle East, as well as in Egypt, so in Africa. So this is something that was ubiquitous, if you will, worldwide, I should say, around the world, that people were benefiting from. And it kind of became a little bit more publicized, if you will, as we kind of see pop culture, right, embracing it. And that's what I was talking about a little bit earlier, how you see Gwyneth Paltrow, right, on the red carpet. She has these big brown bruises on her back with her back out with a beautiful dress, but you're kind of like, what is that? So that was a question, right? I get a lot of questions about that. Then Michael Phelps showed up to one of the biggest stages ever, right, in the Olympics. He has these big bruises on his back. Kind of like, what happened to him? Was that intentional? Was it not intentional? Is that safe? What did he do to himself? Those questions will get a lot. But of course, he performed. He performed his butt off, didn't he? Can't attribute all of that to cupping. But indeed, he thought that that was significant enough, at least from his perspective, right? And the education that he received, that as something like that, they don't choose different therapies and treatments lightly when you're on that level. So he was introduced to that, and then indeed benefited. One of the biggest things that he was trying to accomplish with cupping was injury prevention. He kind of had some injury, or healing, I should say, injury healing, as well as improving his performance, relaxing those muscles because he wanted to be optimal with that competition. So that's kind of where that came from. And then so, of course, you see pop culture, these Olympians, you see all these, them kind of embracing it or doing it. And so in my office, I get questions. What is it? Is that something safe? Because can everybody benefit from it? And that's what we're talking about. So again, historically, thousands of years, and it just became a little bit more public now because you've seen it in the media. Okay? So that's the biggest thing there. So how would I define it? I would define it by saying that in general, when we look at it from a Chinese medicine perspective, they kind of break it down in saying that there's 12 channels essentially when we think about it, at least in Chinese medicine. And those 12 channels reflect organs, or different organ systems like the liver, kidney, so on and so forth. So actually, any questions about what I said so far before I jump in? Any questions about that, guys? If you do, just go ahead and jump down into the comment section. And as every few minutes, I'll stop to try to answer your questions, okay? But again, there's 12 channels that kind of represent the different organ systems, like the liver, the kidneys, so on and so forth. And what cupping is believed to do, and some people believe that it's a placebo effect. Some people believe that it's absolutely scientifically, sound. Research supports both. The research out there, there's some studies that suggest, even when it's a study that was reflecting patients that have chronic neck pain, as well as chronic, hi Sarika, thank you for joining us, as well as chronic low back pain, that they receive temporary to moderate relief with cupping alone. Now consider the fact that, as y'all know me, when it comes to pain management, right, it's always not necessarily one size fits all or one thing fixes it all. So the fact that that's something that you can know now, right, at least if you consider that study as a sound study, to suggest that along with some of the other conventional treatments that patient may be doing, that this could be a beautiful adjunct that doesn't really have much of any side effects to continue to help you along rebounding your health and improving your pain symptoms, as well as, of course, getting you closer and closer to your pain freedom. So that's huge. That's a huge thing to just identify things, and that's what I'm really big on, is identifying things that could be helpful to you for injury prevention, injury healing, performance improvement, that it doesn't really have, that has minimal, if any, side effects. And that's what I kind of like about that. So that's a big deal. So again, you have chi and blood flow. That's the biggest, I would say, the meat of everything. Hi, Jamari. Thanks for joining us. Dee thanks for joining us. Welcome to the broadcast. This is Rebound Your Health TV with Dr. Z, and we're going to be talking about cupping as we're getting right into it. So the other piece of that is So we talked about the chi and the blood flow. One of the biggest things that is believed to do, and I can say I've benefited from as a physician as well as a patient, actually. I've benefited as both in terms of muscle tension. So it improves muscle tension, so it decreases muscle soreness. It leads to improved blood flow, as well as increased toxin release. So getting rid of toxins in the body in those particular areas, as well as improving range of motion, okay? And it's another one. So increased range of motion, increased blood flow, increased toxin release out of the body, and decrease in muscle soreness. And that's only just reflecting the muscle, like the physical pain symptoms that the person may be experiencing. But it also has been thousands of years again to reflect the uses of cupping when it comes to even skin conditions, improving eczema symptoms or acne symptoms, digestion even. And I've actually had, I would say, some side effect, but a good side effect from some of my patients who identify, hi, Ayana, thank you for joining us. Welcome to the broadcast. Share, 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 click sharing. Sharing is caring. If this information may be helpful to you or someone else. But that where was I going with that? Yeah, that the abilities for it to improve the blood flow, I think that's where I was. Y'all let me know. Improve the blood flow is basically really critical. Oh, digestion, that's what I was saying. Improve the digestion for some of my patients. That wasn't the direct indication for why I was using the cupping, but that was an added benefit for a person who may have been experiencing constipation or something like that. That's where I was going with that. So those are other reasons that cupping has been used in the past. I don't particularly use it for things too expensive outside of pain management, but I have in some instances because I've been trained to do so. But primarily, my main point to that is you can benefit beyond just pain in the right hands, of course, of a trained physician. Okay? And then the other piece that I wanted to discuss with y'all was indications. So I'm just looking down to make sure I don't miss any points. Because the main reason I came on here was the three questions, right? What is it, which we answered. What is it for, which is what we're kind of discussing now. Again, for injury prevention, it can help with healing. It can help with improving your performance, because of course we just talked about what it does in terms of improving blood flow, improving range of motion, decreasing muscle pain, muscle aches, myalgia. Some people have heard of that word, right? Myalgia pain. That's been hugely beneficial for a lot of my patients. And it sounds kind of a little counterproductive, right? And I mean, counterintuitive, because one of the side effects, or a few of the side effects that have been associated with cupping, and this is just normal, even in the right hands, you could have some bruising, right? So bruising may hurt, so you may increase your soreness after the treatment. But that soreness, in terms of the side effect, in terms of soreness at least, only lasts about 3 to 5 days. And some people it can last up to 10 days. But typically speaking, it's within a week, and that soreness starts to dissipate. And then depending on your comorbidities or your other diagnoses or other medical conditions and medical history, again, under the right care on the trained physician, they'll be able to identify for you what would be appropriate management, if you will, as you're getting through some of that soreness. But the main side effects that have been associated with cupping is bruising, that's one of them, increased soreness in the area, burning, that's been one, although knock on wood, I've never experienced that, and then skin infection, that's another one. That's also I've never experienced that with any of my patients, knock on wood again. But those are what's, I would say, the primary side effects of it. And then what are the scary things out there that's kind of a bit controversial? You might have Googled it, or you may be Googling it as you're talking to me. Hi, Dr. Donnie. Thanks you for joining us. Welcome to the broadcast. We appreciate your presence, and welcome to the broadcast, Revive Your Health TV with Dr. Z. But some of the scary things that's been out there, if you Google it, like I said, is things like burning the skin off. I've seen some crazy pictures like that online, as well as big, deep, like necrosis almost of the skin. So really bad skin infections, I've seen that as well online. And then some people are afraid about the fire or the burning. I don't particularly use that in the office either, but under the right care, I've seen that with other physicians who were literally even from China, who used it in a different capacity. The main three, I would say, ways you will see cupping done is there's, well, so they say two types, the wet and dry. So you might ask, what is wet cupping? Wet cupping is when you kind of put little piercings in the skin to literally puncture the skin just a little bit, where the blood will pool once the suction cup is there. And then what it's going to do is draw, right? Because the suction is going to draw the blood to the surface of the skin. And what it's believed to be doing is pulling the toxins and increasing the blood flow even more to that area. In the right hands, you know, I guess that could be beneficial. I don't use wet cupping. I use dry cupping. Dry cupping is the other term, which I think is a little bit more common, a little bit more ubiquitous, if you will. Although, again, they're kind of both there, but I say a little dry, a little bit more common, and where there is no puncturing of the skin, but you often can use some kind of barrier, be it like an oil. Sometimes in my office, we may use essential oils, making sure that, again, that's appropriate for that particular patient. And then that cupping can be used in the form, like I said, glass or bamboo, or they call it everything kind of wear, which is almost like a plastic, which is another suction. Okay, any questions so far? Let me go to your questions. Let me go to the comments, see if we have any questions. Thank you guys for joining us. Has anybody out there that's listening right now actually ever used cupping? Let us know down there in the comments, okay? And also, if you could, somebody participate with me and kind of write down some of the things I'm talking about. So if we recap really quickly before I go to if it's appropriate for you, and I know some of you want to know, would that be ideal for me? Somebody write for me wet cupping versus dry cupping. Okay, those are the two types. So you just write down two types, wet cupping, dry cupping. That'll be helpful for the people who are coming back in to this broadcast a little bit later, and they may be watching the replay. So wet cupping, dry cupping, those are the two types. So there's two types, wet cupping, dry cupping, okay? And then side effects, the most common side effects. Somebody can write down for me burning, skin infection, bruising, and increased soreness. If we can participate in that way, kind of get some of that going, okay? So moving on to, we talked about indication, we talked about the history. Hi, Dr. Jared, thanks for joining us. Welcome to the broadcast, Rebound Your Health TV with Dr. Z. Thank you for joining us. Please click share. Sharing is caring. Hopefully maybe you or some of your patients or family members could benefit from this information. And just know that there's other options out there that many of our patients, even some of my colleagues who are here listening to us today, that they just don't know. They're not aware that there's other options outside of the Percocet, or outside of the hydrocodone, or outside of even the Scalaxin. There's other options out there, and so this information could be beneficial to, you know, you, your family, or your loved ones, or even our patients, right? To just kind of identify in the right hands that this might be potentially a option for some. So we talked about history, we talked about the indication, we talked about description, and we talked about some of the side effects. And who is it for? It's for a lot of people, but not everybody. Again, just as I mentioned with me at Rebound Integrated Medical Group under the Rebound Sports Rehab Department, what we try to do is make sure that we do a thorough medical history, a thorough medical exam. It's very comprehensive. People laugh and kind of like shocked at how comprehensive it is, because we're doing head to toe, even though you came in from the shoulder. Because it's really important to understand what's the whole totality in terms of your mobility, your function, how are other parts of your body moving, to make sure we also identifying and looking at your radiographic images, any nerve conduction studies that you may have had, any other treatments you've had in the past. All of that information is important because it helps me with the puzzle, putting that puzzle together to see, are you an appropriate person for this type of treatment or therapy, okay, if you will. So that's one thing that we do very thoroughly. And then the other piece of that is, one thing is it for you, ask your physician to identify if you're in the right hands, is what is their experience, okay? What is that physician's or that clinician's experience with cupping? They should be able to answer, who is it for? And they should be able to answer that clearly, very clearly. Who is it not for? They should be able to answer that clearly. And is it right for you? They should be answered that clearly. And the contraindications, right? The relative and the absolute contraindications for certain patients. And also the training and their experience. I think I said that. So those are some important questions that you want to make sure that your physician, your doctor, can answer as it relates to their experience before you put yourself in their hands, so to speak, to undergo a treatment or like this. And when I say their experience and training, of course, they could say anything, I guess, right? They could say, I took the course. And that may have been a week. I know, not necessarily. optimal, right? But if they did it for a year or more under the particular certified fellowship trained or a true, Chinese medicine or alternative medicine acupuncture courses that are really big around the country and take months to sometimes months, sometimes 3 months, 6 months, 9 months, 12 months, something to that effect. My training was over a year, and I've done hundreds and hundreds of patients and had great basically results with my patients and things. I'll give y'all a quick example. Actually, any questions? Let me go back to the comment section and make sure there's no question. All right. Hi, Ayana. Thank you for joining us. I think I said hi to you, Dr. Shar. Hey, Dr. Shar. Thanks for joining us. Well, I was going to ask any questions about that. Yeah, any questions about that, actually? That was what I'm really getting at. Any questions about what I just noted there as far as what you should be asking your physician, and then the indications. This is not just for athletes. Sometimes I get that question. I'm a sports medicine doctor. Yes, I'm a sports medicine doctor. But I look at myself as a doctor for everybody, quite frankly. Because eventually we're human beings, and that's what I appeal to, your human nature and the human body overall. I can't do everything, so that's not what I'm saying. I can own what I don't do. Some things are just not my lane. And I'm not, and I will refer you to a lot of my prestigious colleagues that are here watching and joining us today. Hi, George Juma. Thank you for joining us. Welcome to the broadcast. Hi, Tracy. Welcome to the broadcast. Join. We thank you for joining us today. This is Rebound Your Health TV with Dr. Z, and we're discussing cupping, what the indications, the history, and is it right for you, or is it safe for you? Essentially, what it does is indicate for injury prevention, for healing, actually injuries itself, for improving your performance for competition or for a race, as well as improving your blood flow and increasing your range of motion, and increasing or improving your decreasing the injury duration, if you will. So for healing, essentially. So that's the indication for that, for cupping, and we kind of discussed that a bit. So I think that might do it for me, unless I have some questions. Or did I get cut off? I'm still there. Yeah, I'm still there. Y'all still there with me? Say hey if you're still there. Sometimes it's the technology wants to be fickle. I just want to make sure that you guys can still hear my voice and I'm still there and you can still hear me that way. If you have any questions, you can go ahead and shoot them down in the comment section. If you ever experienced cupping, you may have a question about that. If you want to know where you can go to maybe learn more about cupping, you definitely can visit our website at www.rim- that's the dash not a slash group.org, or you can visit my actually contact us at email info@drzarina, that's info at drzarina.com, and you spell my name DRZARINAH.com. If you had any further questions about that. All right, happening so far. Okay, can I see your comments? Well, I feel like I don't see y'all comments. It says 25 comments and I don't even see everybody's comments. Oh, there it is. Hey, y'all. This is all delayed. I told you technology is a trip. Y'all think I'm ignoring you, but I'm totally not. Now the comments are rolling in and they're coming like boom, boom, boom. So George Jackson, Junebug, he said, you tore your quad years ago. Will it help? Yes, provided, Junebug, that you don't have any, major issues. Again, your medical history is still important, but definitely visit us again at www.rim-group.org to find out how you could be beneficial, how we could better potentially help you. We're kind of located in South Atlanta area, but yes, it can definitely help you. It helps a lot of people in that quad area, depending on kind of where you are in the phase of injury. But typically what it's going to do is, again, improve the range of motion of that quad. It's going to improve the blood flow. And typically after an injury, if it didn't completely heal all the way, so you have partial healing, if you will, of that torn quadricep, then that's where the cupping or something like that can be beneficial, because it's going to help bring blood flow. Blood flow is life, guys. And at the end of the day, Junebug, as you just speaking to your quad tear, is if there was any issue with the blood flow bringing in there, then that's what the cupping is going to maximize or try to bring blood flow, because that's also going to bring the healing cells into that area, what we call this cascade of macrophages, or B cell, T cells, and things like that, our platelets, which is really, really critical for muscle healing, tendon healing, so on and so forth. So that's a great question. Any other questions? That's a great question. Definitely Or you can also email us at info@drzarina, info@drzarina.com. Alrighty. Any other questions? Thank you, Dr. Jared. Thank you. This is very informative. Thank you, Dr. Z. Absolutely. Thank you guys for joining us. And again, share this information. It may be helpful to others. Okay, I see that more questions that I can't see. If there's a question that I'm not seeing, you guys are asking them and I just don't see it, be rest assured I'll actually watch this video shortly after we end this video, and I'll try to get to your questions, okay? Get back into the comment section. And again, I am Dr. Zarina, also known as Dr. Z, your sports medicine and integrative medicine specialist, here to help you rebound your health through my different programs and services such as consulting services, telemedicine, private practice, concierge practice, and other products to come to help you ultimately obtain your pain freedom. You guys are my MVPs. You're your own MVP. That's what this is all about. I'm coming to you weekly with Rebound Your Health TV with Dr. Z for that very reason. No other reason, not to serve myself, but to simply serve you and the world, to make sure that you guys have the information, that you're empowered with knowledge so that you can help yourself, right? Better help take care of yourself, because we only get one human body. So we definitely have to maximize that. It's a machine. It will, I promise you, it will work for you if you work for it, okay? And at the end of the day, our body has rights over us. And if we don't feed it and engage it in the optimal way, it will definitely let us know. And I know many of you out there that hear my voice or see my face and hear me talking to you, you experience that, or you know someone who is experiencing that now. And I'm here to let you know, to put you back in the driver's seat. You can put yourself in the driver's seat. You are your own MVP. And say it, I am my MVP. That's the chant I want you to tell yourself every morning, because you have every tool. Where we're going to try to give you every tool at least, so that you can maximize your health, rebound your health, ultimately attain your pain freedom for you, your loved ones, and everybody out there. I think I have one more question. All right. But guys, thank you for watching. Not going to take us much more of your Sunday. You can always hit this on the replay, of course, as well. And I hope you guys have a great week. Rush right into that week to make sure that you're doing everything that you can to rebound your health. I'll be here next week to help you and to educate you and to just bring you whatever I have. And what I have to give, I'm going to give it all. All right, guys, love you guys. Thanks for joining us. Share, hit notification down below, and we'll see you next week.